Good evening, everyone. Thank you for joining the Division of Developmental Disabilities on our very first Facebook Live event. My name is Matt Wagoner, and I am the Information Specialist Statewide Lead for the Division. And I'm joined tonight by Dr. Malik Trivedi and Amanda Barnes-Adams. And we're here tonight to talk about Stationmd and the service and agreement and partnership that we have between the division and Stationmd. Dr. Trivedi is an emergency room doctor by trade, and he's one of the owners and founders of Stationmd. And we're thankful to have both of you with us this evening. Dr. Trivedi, we just want to give you the opportunity to introduce yourself and tell us a little bit about what Stationmd is and kind of where it came from.
Thanks, Matt. Thanks for having me. I have to say this is my Facebook Live debut, so I'm excited to be here and excited to participate. Essentially what we are, Stationmd, is a group of physicians. We are ER physicians that have a specialized certification and understanding of the IDD population, individuals with intellectual and developmental disabilities. Our goal and our mission is really to improve the quality of care for this population, and we use telehealth or telemedicine to deliver that care. We've been doing this for 6 years or so, so I guess that kind of makes us pioneers. Telemedicine is a relatively new field, and the state of Missouri, and specifically Division of Developmental Disabilities, has been very progressive and very forward-thinking and collaborating with us to bring our solution, our telehealth and telemedicine services to the state of Missouri. So we're excited to be working with them.
Great. We're so glad to have you and glad to be partnering with you. Dr. Trivedi, give us kind of a generalized overview of who might be eligible for services through Stationmd.
Sure. So we started in April of this year, and anyone that is a Medicaid waiver recipient, which is almost over 15,000 individuals in the state of Missouri, is eligible. And they're already pre-enrolled. There's no enrollment process that needs to be done. Been pre-registered by the state, and the state has already guaranteed their coverage. So there's no cost or no additional cost. But those are the people that are eligible for coverage. That is not based on any geography. We have individuals throughout the entire state, all different parts and regions that can use the service immediately. We are available 24/7, and if you need to speak to a physician, we are there to provide those services for you.
Great. So just to clarify and bring that point in, is that anyone that is currently enrolled in one of our Medicaid waivers, so that's the comprehensive waiver, the community waiver, the MoKids waiver, is already enrolled. We've provided Stationmd with their information. It's an easy process to access the service. If you're on a waiting list to participate in the waiver, those individuals are not eligible to participate at this point in time. So I wonder if you could kind of walk us through some of the typical medical issues that you might address through Stationmd.
Sure. So as I mentioned, all of our physicians are emergency medicine physicians, so we can see pretty much anything and anyone that you can think of. In addition, our doctors are specifically trained and go through a process where they really learn about the clinical nuances of this population. So specific examples that we would get would be any issue that's a non-life-threatening medical condition that you want to speak to a doctor about, you can call us. I say if it's a non-life-threatening issue and you're not sure whether to call us, just call us. Some of the typical ones are fever, falls, rash, maybe a urinary tract infection you may be concerned about. But it can be a simple question about a medication. It could be a medication refill. What we're also getting a lot of course, everyone's concerned about is what's going on with the crisis, COVID-19. And some of these are just questions about clarification, whether it's about use of a mask or who needs a mask. It's a confusing, frightening time for everyone. And the way our service is set up, again, through the division, and they've been very generous in providing this service during this time, is really to keep individuals safe and at home. Our goal is to keep individuals safe, but also those caring for those individuals. That means support staff, that could mean family members. So if you don't really need to leave your home setting, please don't. That really puts the individual at risk and everyone along the line there, whether it's the person who's transporting the person or the person caring for them. But those are some of the common reasons that we get called for. But again, it could be a question about a medication or a question about something medical that you're concerned that you want to speak to a doctor. And now you have that ability to speak to a doctor within minutes, and not only speak to a doctor, but we can visually see them and do a virtual consultation.
And I think it's really important to highlight and not to disparage, but you're actually speaking with a doctor. You're not getting a nurse practitioner. You're speaking with a doctor to provide that consultation.
No, absolutely. And, our physicians are on 24/7. I'm very proud of the doctors that we have working for our organization, but they not only are ER physicians that are trained to understand medical issues, but, they really understand this population. I think to date we have something like 15,000 virtual encounters, and 99% of those are with individuals with IDD. So we understand the limitations, and we understand the clinical implications. So we all know that minor things in this population can turn into serious conditions if not addressed, whether it's simple constipation or a UTI. A constipation can turn into bowel obstruction. A UTI can turn into urosepsis. If an individual doesn't get their seizure medication in a timely manner, they can have a seizure. So these are minor issues that may seem minor, but they can become serious if they're not addressed. And let's just face the facts. It's tough to get a doctor on the phone sometimes because they're busy all day and it might be in the middle of the night. And on top of that, sometimes it's tough to make an assessment with just a phone call or a text. And this kind of solution allows us to visualize the patient. We also have access to the individual's medical records. We are able to really get an exam that's pretty thorough. So again, most of the time we can address those issues using our telehealth consultation. I will add quickly that if the individual does need to be sent out and we feel that, hey, it's best to get sent to the emergency room or urgent care, we will contact that urgent care emergency room to let them know and give you a heads up. And hopefully that'll expedite the care and maybe limit some of the tests that you may be getting. I've been practicing emergency medicine for 20 years, and I'll be the first person to tell you that if you don't need to go to the ER, don't go. It's not always the quickest, solution, and not always the most optimal for your medical condition. Of course, it's needed, and we are not there to replace 911. And thank God for the emergency departments. But anything that we can do right now in today's day and age of the pandemic to keep you at home in your home setting, we will try to do.
Right. And I think that, again, it's important to kind of highlight that you're not trying to replace that primary care doc. You're wanting to work in conjunction with them.
Yeah, no, that's a great point, Matt. What we do is we really there to augment the primary care physicians and really help in care coordination. These doctors are busy and they have patients that are dealing with all day, and it might be at the end of the day, it could be during the day, and we can really help fill in those gaps in care and address urgent issues. And again, I'll have to emphasize that we have a technology that is very simple to use. We're on a WebEx right now, but if you're familiar with FaceTime or Skype or Zoom, it's really just that. Of course, everything's HIPAA compliant and we adhere to all telehealth and telemedicine regulations, but it's very easy to use, and it really allows us to visualize the individual. And as I mentioned, we have some history, we have access to the patient's records that allows us to give a much more robust consultation, a robust recommendation, where even if you do get a doctor on the phone, it's hard for them to make an assessment without really feeling uncomfortable. It's tough on the phone sometimes. You don't really get a good picture. So yeah, and again, I will emphasize that if an individual does need to go out, we will send them out. You can't handle everything using telemedicine for sure.
So kind of as we're kind of drawing this thing down to a close, walk us through kind of the process of getting in touch with, making that call.
Sure.
How do we do that? How do we go about that?
Sure. So it's very simple. The process is easy as a phone call. There's one number that you would call. It's 877 STAT MDs or STAT MDS, and we can provide that information to you. You can also go to our website and get that. And then that phone number will connect you with an individual that just gets some basic information and we'll walk you through the steps. If it's your first time calling, that's completely fine. We can get you and walk you through the steps to see a physician. So after that phone number is called, the physician will do their virtual consultation. We have an app that you can download where it's essentially, as I mentioned, like a FaceTime or Skype, which the physician will be able to see the individual that needs the care. And again, these navigators that we have, that number that you call, will walk you through that process. It's very simple. I tell you, when I started doing this years ago, having a video consultation or talk with someone was still a novelty, and now everyone has a video phone in their pocket. So that's really all it is. The doctor will do their consultation. They usually come on within minutes. They'll answer some questions, your questions. They'll be able to do a virtual examination. And then, as I said, we have access to that individual's medical records. So we may be able to tell you their past medical history or allergies. And then the doctor will institute their treatment plan. We have the ability to e-prescribe if the individual needs medications. And I want to emphasize also, it's not a once and done thing. That oftentimes I'll get a call for an individual and I may assess them and I may institute some intervention, some treatment or medication. And then I'll say, hey, call me back in an hour, or let's call me back. I'll call you back in an hour. So we really are there to protect the individuals and really keep them in place whenever possible. But again, if there's a question about calling, just call and we'll walk you through it. But the steps are very simple.
Great. Isn't that terrific? So I want to introduce Amanda Barnes Adams. Amanda is mom to a young man that is in our services, and she's agreed to just come on and talk a little bit about her experience utilizing the Stationmd services. So Amanda, we're going to turn it over to you.
Hi, hello everybody. Like Dr. Trivedi has said, this is an easy program. Our son Cooper is 10. He's nonverbal, severely autistic. At the beginning of summer, he started not feeling well. So I decided to use Stationmd. I called in, activated his account, just took a few moments. After his account was activated, I was then called from Stationmd. Gentleman took a few vital stats on Cooper, gave me an access code, and said within a few moments, a physician will access him through the app. So I typed in the code. Within a few moments, the physician, Dr. Kelly, came live on the app, asked me a few essential questions about Cooper to assess him. Come to find out, he loves to swim. This is something that if I would have had to take him out of the house, take him to the doctor's office, make an appointment, have him seen, it would have taken all day. He would have had an anxiety attack, would have led to a night of no sleeping. With Stationmd, we were able to stay in our home. Within 1 hour, we saw a physician online. We're able to have our prescription and go to the pharmacy, get it, and come home within the hour. We never had to leave our house. This was so easy, simple, and is exactly what these kids and these families need. Not only does it keep our kids and our families safe from catching other things that are going on in our world right now, but it also keeps them comfortable. And that's what everyone needs right now, is comfort. So this is a wonderful program. We are so thankful for it. So thank you, Dr. Trivedi.
Thanks, Amanda. I mean, that I couldn't think of a better example of the use of this service. And as Amanda said, I'm probably preaching to the choir with those of you who are on right now, but we call it the trauma of transport. Sometimes simple things that need to be addressed, the individual just getting them to the clinician or the office or the urgent care ER is traumatic in itself, and really sometimes takes days to weeks to that disruption in routine to get normalized. And again, I don't have to say to anyone else that that's on this call right now that right now there's so much uncertainty and danger with leaving your home. If you can address these issues in a home setting, that's by far the best for everyone involved. So thank you for that story, Amanda. And we are very proud of what we do, but this would not be possible without the state and the division taking on this very progressive project. They have really taken the lead on protecting individuals and really serving the disability community in the state of Missouri.
Yes.
Thank you so much, Doctor and Amanda. I'm going to share a quick, I'm going to share my screen. So this is the division's webpage. So back in April, when we instituted the agreement, a partnership with Stationmd, a packet was mailed out to all the individuals or their families. We know that life happens and that you might be going, I don't know where my paperwork is. If you go to dmh.mo.gov and you select the Developmental Disabilities tab up here at the top, it pulls up this page, and right here on this blue ribbon is Stationmd. If you click on that, you come to information, it'll give you all kinds of information about Stationmd. Then here you will get your individual and family packet. If you click on that, it's the letter and all of the information that you need to make that initial call, set up the app, get your access code. So you don't have to wonder going around, where did I put that packet? Saved it to the web page, locate that, and you can begin the process of accessing the service. Again, it's available 24 hours a day, 7 days a week. It's available to all Missourians that participate in one of our 3 Medicaid waiver agreements. And we want to encourage everyone to use it as often and as much as you need to stay home and to stay safe. The last thing I'm going to say is that any comments or questions that have arisen during the chat tonight, those are going to be answered later just for the sake of time. But they will be responded to. So we encourage you to, if you continue to have questions, please put them in the comment section in the chat, and we'll respond to them and get answers back to everyone. This recording will stay on Facebook, but it should also, we hope to be able to save it to our Facebook or our YouTube account as well. So I want to thank Amanda, Dr. Trivedi for being with us, and we look forward to maybe doing something like this again very soon.
Great. Thank you, Matt. Thank you, Amanda. Thank you.
Have a good evening.
You too. Bye-bye.